All right, today we're going to dive into some really cool PhD research that could actually change the way we approach periodontitis. It tackles a massive question. Is our gold standard treatment really enough? And, can new tech make it even better? Let's get into it. Now, if you're in the dental world, you know this all too well. Conventional treatment, scaling and root planing, it just doesn't always get the job done, especially when you're dealing with those deep, stubborn periodontal pockets. And that's exactly the problem that the PhD research we're breaking down today is trying to solve. So here's our game plan for this explainer. First, we'll look at the research itself. Then, we're going to unpack the modern way of thinking about periodontitis, which is super important. After that, we'll check out the 3 new treatment protocols they tested, see what the results actually were, and wrap up by talking about what it all means for the future of how we care for our patients. So this work comes to us from Dr. Marwan El-Mabadr at Wroclaw Medical University. And his goal, well, it's pretty simple, but also a big deal: to find better, less invasive ways to treat periodontitis. The whole idea is to combine things like lasers and antiseptics to give our standard treatments a serious boost. Okay, before we jump into the fixes, let's just make sure we're all on the same page about the problem. Look, periodontitis isn't just about sore gums, right? We're talking about a chronic inflammatory disease kicked off by a bacterial biofilm that literally destroys the very foundation that holds teeth in place. It messes with how people chew, how they talk, their entire quality of life.
To really tackle this, we've got to change how we think about the problem itself. Our whole view on what actually causes periodontitis has really shifted, and it turns out it's way more complicated than we used to believe.
The big word here is dysbiosis, and you really got to wrap your head around this one. Think of it like a complete breakdown of the ecosystem in the mouth. We used to think it was just a few specific bad guys, a few bad bacteria, causing all the trouble. But the new thinking is that it's the entire microbial community getting thrown out of whack that really fuels the disease.
But here's the kicker. Even though it's a whole community problem, research is pointing to one specific organism that kind of acts like the ringleader, and that's Porphyromonas gingivalis, which scientists are now calling a keystone pathogen.
And that keystone idea is just perfect. Think about a stone arch. The keystone is that one stone at the very top. It might not be the biggest, but if you pull it out, the whole arch collapses. That's P. gingivalis. It might not be around in huge numbers, but it has this incredible ability to mess with our immune system and create chaos, letting the entire bacterial community turn destructive.
So, with this whole new understanding of dysbiosis, you can see why just scraping things clean might not cut it anymore. That's why Dr. El-Mabad's work looked at 3 new adjunctive therapies, basically helpers designed to give that gold standard treatment a much-needed power-up.
All right, so they tested 3 different approaches. First up, they combined hydrogen peroxide with a 980 nanometer diode laser. The second protocol used sodium hypochlorite with that same laser. And the third was a totally different technique called photodynamic therapy, or PDT.
Okay, this is where the rubber meets the road. Did any of this stuff actually work better than just good old-fashioned scaling and root planning on its own? Let's check out the data. First on the list, the combo of 3% hydrogen peroxide with an infrared diode laser. They really wanted to see how well this could kill off the bacteria. And wow, the results here were pretty dramatic. The group that got the hydrogen peroxide and laser ended up with a bacterial count just under 2 million. Now compare that to the group that just got conventional treatment. They had over 35 million. Think about that. We're talking about a massive, statistically significant drop. This combo is way better at disinfecting.
Next, they tested 0.5% sodium hypochlorite, a really powerful disinfectant, and they paired it with that same 980 nanometer laser.
And once again, really strong results. This protocol knocked down several of the key bad guy bacteria. But look at the clinical numbers. 6 months later, the average probing pocket depth was just over 4 millimeters in the study group. The control group was almost 5.3. A full millimeter reduction might not sound like a lot, but in periodontics, that's a massive win. It can be the difference between saving a tooth and losing it. Okay, the last protocol was photodynamic therapy, or PDT. This is a much more targeted approach. Basically, you apply this special dye that sticks to the bacteria, and then you shine a specific laser on it, in this case, a 635 nanometer one, which activates the dye and poof, the bacteria are gone. It's pretty cool stuff. And at the 3-month follow-up, the PDT group also showed huge improvements. pocket depths were way down, but check this out. They also saw a significant improvement in clinical attachment loss. That's the real measure of the actual destruction, And improving it is, well, it's pretty much the holy grail of perio treatment.
So when you put it all together on a chart like this, the picture becomes crystal clear. You can see the reduction in pocket depth for each protocol. Yeah, conventional treatment helps, but adding either the sodium hypochlorite with a laser or the PDT, it just works better. The takeaway couldn't be simpler. These adjunctive therapies really do outperform the standard of care.
All right, so what's the big takeaway for you, whether you're in the clinic already or you're still in school? What does all this research really mean?
Look, the bottom line is this. Adding these technologies isn't just some small fancy add-on. It's a real upgrade to our patient care. This research shows that they seriously improve outcomes by hitting the disease from both sides, killing more bacteria and improving the clinical signs like pocket depth and attachment loss. This is especially true for those really tough cases that just don't respond to conventional therapy alone.
And really, Dr. Elmo Botter himself sums it up perfectly. The future isn't about throwing out our old tools. It's about adding new, proven technologies to them to build a more comprehensive treatment plan that gets the absolute best results for our patients.
This kind of research is so exciting because it opens up a ton of new possibilities for treatments that are not only more effective, but also less invasive. It really makes you wonder, with everything we're learning about the microbiome and as technology keeps getting better, what's the next big breakthrough going to be?